Hey everyone, so my name is Marie Catherine. I'm the person behind Nurse Diaries, and today I'll be speaking to all of you about what it's like to be a student nurse and what to do in order to overcome challenges that you may face on placement. So being a student nurse includes having lectures, university and placement. And placement can be once, twice or 3 times within a year depending on what year of nursing you're in. So whilst being a student nurse and having placement, you're always allocated a new placement to go to. And when you're allocated your placement, unfortunately, you're not allowed to choose where exactly you want to go for placement. Your university chooses your placement for you. And sometimes this can be amazing because you can end up on awards that you've never ever expected and you end up really enjoying it. Other times you may be on a ward that you probably did not necessarily want to go to, and it may be something that's quite scary for you. So this video is just talking about ways in which you can overcome those challenges. So for example, when I was in my second year, I was on a ward that I was not too familiar with, and to be honest, I wasn't really fond of. And as a student nurse, you have to learn to adapt to every environment that you're going to, even if you're not, if it's not your favorite placement, and if you've had better placements, it's always important to just stay positive and try and overcome this situation. So obviously that's easier said than done, because you have to find some kind of motivation to wake up at 5 o'clock in the morning and go to your placement. But one thing that I would say is always talk to your friends or family near you, because it kind of does help you to give you more confidence and gives you a reason to carry on going. I know it can be very hard, and I've had people message me telling me what kind of motivation can I give to them. Another thing that I would say is just thinking of the long journey, thinking of the reason as to why you started your course in the first place, thinking of the reasons as to why you want to be a nurse. And if you think of that, then honestly, regardless of it being an environment that you're not too familiar or fond with, you will still end up getting through it day by day. So that's the advice that I would give to you. If you're at a placement that it's not like you don't enjoy it, but it's just maybe your assessor who you think is not providing you with as much help as you would like them to, I would always say speak to your ward manager about it, because as a student nurse, sometimes the people that we need to speak to, we cannot, because we feel as if they would judge us. Our ward manager is actually there. They're the people who, if a situation occurs on placement, they will be contacting your university. So therefore, if you're not happy with something, it's really important that you speak to them about it as well, because they can actually help you. I had a situation where I wasn't happy with the way in which I was learning. I felt like I had an amazing ward. I really enjoyed the ward, but I feel like there was, I don't know, there was more to it than what I was being shown. I felt like I could have learned so much more. So I went and I spoke to her and I said to her, I really want to learn more. I want to start doing my proficiencies in my book, in my PAD document. So for those who don't know what a PAD document is, as a student nurse, there's a book that we have, and you get to sign off your proficiencies every time you go to placement. So that's something that I really spoke to her about. I said to her, every day I want to achieve different goals in my document, and to make sure that I also get that document signed. So it's really important you get that signed. So what did I do? Yes, I told her about it, and she said to me, okay, so now that I know this, I'll make sure that every staff member ensures that you actually get what you need to get out of this placement and make the most out of it. Once that conversation happened, the next day I had the opportunity to actually put in an NG tube into one of our patients, and that's something that I've always wanted to do, and I've always watched the nurses do it on the ward, and I was like, I want to try as well, but they thought that I was just, trying to be like I was just too excited basically. But I feel like it's good to be excited and it's good to ask, and after talking to the ward manager I actually had the opportunity to do that. So that's one positive of actually speaking up for yourself, and it's something that, as I said before, I advise you all to do because it actually benefits you as an individual. And from that situation, ever since that day, when I went back into placement, I actually really enjoyed it. I was able to learn a lot and I was able to make the most of every opportunity, which was amazing. So I feel like sometimes as a student, I know it's a bit overwhelming. You're thinking to yourself, like, how do I speak to these people? Because at the end of the day, they're also assessing me. But at the end of the day, you just need to think to yourself, you're there to learn and you want to make the most out of your situation, because you're not going to ever get the same placement again. Every placement is always, well, it's usually always different. I'm saying usually because I know sometimes people get the same placement. I don't know why that happens, but yeah, so it's really important that you make the most of every situation and just know you're not alone, because we all go through it. There's times where we all need motivation. I need motivation. I have to always call my sibling or call my parents or my friends and tell them that I need motivation. So you're not alone, and placement is tough, university is tough, but we're all in this together. Yeah. So to summarize everything that I said, I'm advising you guys to push yourselves in any situation that you're in. I know it's not easy, but at the end of the day, it will be worth it in the end. And if you have a placement that you're not too sure about or you're not too fond about, I would also advise you to just think of your end goal. Think of why you wanted to become a nurse, think of the benefits of it, and think to yourself, you're not the only person out there. If others can do it, then you can do it too. And if you need advice or help, message me on Instagram or YouTube, Nurse Diaries UK, and I'll be more than happy to help you guys. Thank you.